Thank you, Jackie. Good afternoon. My name is Sophie Gasset. I'm a member of the Class Day Committee, a proud member of Section J, and of the HBS class of 2011. And today I have the honor of introducing our keynote speaker, Ms. Kathy Giusti. Today, Kathy is a successful entrepreneur in the nonprofit sector. But in 1985, when she herself graduated from HBS and sat where you are all sitting here today, that was not quite the career she had in mind. Prior to HBS, Kathy had begun pursuing a career in the pharmaceutical industry as a sales rep at Merck, where she was identified as a high-potential employee. After HBS, she first went to work for the Gillette Company, and then later joined G.D. Searle, a life sciences company. There, Kathy's career was on the fast track, and she aspired to be one of the first female executives. But her life and her career took an unexpected turn when at the age of 37, she was diagnosed with multiple myeloma, a deadly blood cancer for which there was no cure. Kathy left her job as executive director of G.D. Searle's worldwide arthritis franchise to focus her attention on researching myeloma. She quickly found that she was faced with an orphan disease, one which affects relatively few people. Such diseases receive very little attention from drug companies, which prefer to focus on diseases affecting much larger populations, given the extremely high cost of drug development. With this in mind, Kathy founded the Multiple Myeloma Research Foundation and the Multiple Myeloma Research Consortium to raise funds and attract researchers to the field. Competition among scientists and clinicians is a major obstacle to drug discovery and development, and the task of convincing researchers from different institutions to collaborate is a very challenging one. Yet Kathy succeeded in doing exactly that, forming a community in which scientists from different centers publish their research findings together and collaborate on clinical trials of promising drugs. To date, Kathy has raised more than $165 million for myeloma research. There are now 4 FDA-approved drugs for treating myeloma and more in the pipeline. And the average life expectancy for people with the disease has more than doubled. Kathy is recognized for advancing medical research and accelerating drug development through collaborative research models. And the Multiple Myeloma Research Foundation and Research Consortium are regarded as best-in-class models for running highly disciplined nonprofits. For her leadership, Kathy has received many awards, including the Harvard Business School Alum Achievement Award and the Healthcare Business Women's Association's Woman of the Year Award. Most recently, as Susan mentioned, Kathy was also named one of Time Magazine's 100 most influential people in the world. Without further ado, please join me in welcoming Ms. Kathy Giusti.
Thank you so much, Sophie, and thank you, Jackie. That was great. I have to tell you, what a wonderful, wonderful speech. It is just an honor for me to be here, and Dean Noria, I just want to thank you and the faculty for all the support that you've given to the MMRF over all the years. And I want to also make sure I extend my sincere congratulations to all of our graduates and your families. I have to admit, I was very humbled by this invitation to join you on such a special and momentous day. And I have to say that I graduated from Harvard Business School 25 years ago. So I guess I do have a fair amount of wisdom at this point. But this day is actually one of the most memorable of my life. And I do remember exactly how I felt when I sat out on the lawn, just like all of you. I was a little unsure of myself because I certainly wasn't a Baker Scholar, and I didn't consider myself to be the most accomplished of the 800 students that surrounded me. And I was a little bit humbled, but I have to say that I did understand that I had gotten through Harvard Business School without ever coming here with a business course. My background had always been on the science side. But I left here so much more knowledgeable about business and about myself. But if you had told me on this day 25 years ago that I would start my own company, that I would become an entrepreneur, I would have said, no way, absolutely not. I thrived working in big organizations. I was definitely not thinking in those terms. But I do stand here today in front of all of you as an entrepreneur, and I can say that I'm in an amazing place. And I'm sure that sounds a little bit unusual to all of you, having just heard that I face a fatal cancer every single day of my life. But the truth is, no matter what happens, I can always look back and know that I've raised a beautiful family, I have changed lives, and I've left a legacy. And you can't live a life much better than that. So my hope was that today I could come and share my journey with you so that you could start to envision your own journey, that perhaps I could give you that 25 years of hindsight. Because you have been given this amazing gift that very few receive. It's the gift of a Harvard Business School education. And if you build on it, you will lead, you will create change, and importantly, you'll have a life that's rewarding, one that makes you happy. John Lennon once said that life's what happens to you while you're busy making other plans. And just like all of you, when I was leaving here and catching my degree, and I was heading over to work at the Gillette Company to learn consumer marketing. And I knew that that was a great blend, my high science with the consumerism, and it really did help me when I got back into the pharmaceutical industry and started working at Searle. It seemed like everything I was touching at Searle was really turning to gold. I was working with the board, I was working with R&D, I loved my job. And my personal life was just as wonderful. I had married my Harvard Business School classmate, Paul, who's here today. We had a beautiful one-year-old girl, and we had just bought a new home. And just when we thought life couldn't get any better, my life stopped. It just stopped. On January 12, 1996, I was diagnosed with multiple myeloma, and I remember it well. The oncologist just holding my hand and looking me in the eyes and saying, "Kathy, I am so sorry. This disease is fatal. The lifespan is about 3 years. You just need to go get your life in order and spend time with your family." Clearly, it was time for a new plan. I had to ask myself a really tough question at that point. Despite knowing that I was dying, what would possibly make me happy? And the goal became clear. I just wanted to live long enough that our daughter, Nicole, would remember that she had a mom. If I lived just a little longer than 3 years, maybe till she went to kindergarten, she'd remember that I had been with her. I knew the odds were completely against me because I had worked in the pharmaceutical industry. I looked and I saw there was no funding, no awareness, nothing going on in this disease, no drugs in the pipeline. The treatments offered to me in 1996 were the same ones offered to my grandfather who battled the disease in 1956. So I had no choice. I had to start an organization that would change the dismal statistics. I founded the MMRF, but I do admit I was very much a reluctant entrepreneur. I can look back now and say the MMRF has gone through several phases of innovation and transformation, and they were so critically needed in the healthcare system. Because when we started, there were no scientists that would work in myeloma. It was an uncommon disease. We had to raise the money to entice them to come to the field. And the hard part about that was 90% of nonprofits never raise over $1 million. But we did. To date, we've raised over $165 million. We have funded over 500 scientists worldwide. And while that's great, what we really found was there's no easy way for those scientists to work together. It's not that they don't want to, it's just that it's really hard with the systems and incentives that are in place right now. So we had to build a new model, a clinical network that would allow centers like the Mayo Clinic and Dana-Farber and Emory to integrate and to do tissue banking with us, to conduct phase 1 and 2 clinical trials with us. That clinical network today has fielded 30 trials of 18 drugs and has done it 60% faster than if industry was doing it alone. So as you heard Sophie say, we have been incredibly fortunate in myeloma to see 4 drugs FDA approved and 8 more in phase 3 clinical trials. It usually takes about 10 years to get one oncology drug to market. So it's a little bit ironic today that we face yet our greatest challenge ever in myeloma, and that's the knowledge that this cancer, just like every other cancer, isn't just one disease, it's more like 10. And we're going to have to cure each one with the right combination of drugs at the right time. And that is the entire field of personalized medicine. And once again, it's a field where everybody's talking about it, but nobody's yet doing it. So we will be investing $40 million over the next several months with a full initiative, and I have no doubt that the MMRF will lead the way in this field and teach every other cancer how to do the same thing. Many of you first met me, and I know Sophie had mentioned this too, when you were watching The Money Chase, a piece that was on CNBC with Carl Quintanilla. And that piece followed a number of first-year students and a number of HBS alum. And if you remember, at the very end of the piece, Carl Quintanilla asked me the question, did Harvard Business School save your life? And I responded emphatically with a yes. And I hope now you can understand why. I was faced with one of the most challenging situations. I had to set a goal. I had to figure out a new company. I had to lead. I had to build a plan. It was the skills I learned here that allowed me to do all of that. And while all of that is incredibly important, I will tell you that there are 3 other things that have been just as important to me too, and I hope that you'll take note of these and think about them as I just mention them to you. Number 1, you have to take risk. You absolutely have to take risks. I wasn't a risk taker when I left Harvard, but after being diagnosed with a death sentence, my profile definitely changed. We never had a single model to follow in myeloma. We were always leading the way. So every move we made, every program we developed, every new model was the first one going out the door. But I have to say that intensity and that focus allowed us to get new drugs to market and extend our patients' lives. And it's been worth it. The second is, you have to persevere. I actually thought that I would run the MMRF for just 3 years. And now, thank goodness, it has been 13 years. And every year, thank you. Every year I hear the same kinds of comments. It's never going to happen. You'll never get it done on time. The academic centers will never collaborate. Pharma's not going to give you that data. I have to tell you, when you develop the right programs, the right models, and it's a win situation for everybody, it gets done. Just stay true to your mission. And if you think about those 13 years, yes, it was a lot of uphill battles on the professional side, but it was 13 years of chemotherapy, a bone marrow transplant, isolation, running meetings while I was bald, jumping on planes petrified of the infections I was going to get next. But you know what? I did persevere, and I can tell you that it has been completely worth it. The third, partner wisely. If you are going to do something different, something that's going to really lead to change, you have to work with people that give you energy, that share your dreams. When we started building for personalized medicine, and it was a new model, I knew exactly which CEO I was going to go to. It was the one who wanted to be innovative. I knew exactly which academic center I'd go to. It was the center that was going to give up on the legal control for the best interest of the patient. And I knew exactly which researcher would help me too. The one that would give up being first author on a publication because he really wanted to find a cure. Know these people. Make sure they're the people that you stay with. So it is 25 years later, and I hope that I can share some elements of wisdom with you. Set a goal you are hugely passionate about. For me, it was seeing our daughter go to kindergarten. Use your knowledge that you've gotten here so that you can build a plan, so that you can do something different, and along the way, take risks, persevere, and find the right partners. But my most important lesson for all of you, don't wait for a crisis, a tragedy, a cancer diagnosis to do something amazing with your life. Ask yourself these questions now. Ask yourselves how you can make a difference, what you want to change. I still wake up every day and I think, oh, I'm normal. And then I go, no, I'm not. I still have cancer, and it's still fatal. Some days are a lot harder than others. I would say the days that Paul and I drive to Dana-Farber and get all the tests drawn, and we're busy waiting and anxious to hear what the doctors have to say. And I can tell you, even now, that knot in my stomach never goes away, because every time I relapse, my window of time gets shorter and shorter and shorter. But every time I face that kind of uncertainty, every time I look at my mortality, two questions come to mind. Have I made a difference? And have I been the best mother and role model I could ever be? And I can say yes to both. That little girl, Nicole, who was 1 at the time, she's now 16 and a junior in high school. She is the captain of her cheer team, an honors student. She's an advocate already for cancer patients and children with AIDS. She's amazing. And I know I sound like a proud mother, but I'm just so happy and blessed to have seen so much with her. She also has a brother, David, all part of a plan, and he's 14, hysterically funny, and he gives me a run for my money every single day. I have seen so many firsts. First steps, first day of school, first home run, first prom. I've never, ever taken a single one for granted. And as I see each first, it's kind of interesting how the next one emerges. Paul and I were walking college campuses with Nicole, and I said to myself, how lucky am I? I thought maybe I wouldn't see her to kindergarten, and now here I am on college campuses. And then immediately, that moment hit me, and I said, I wonder if I'll be there when she gets her acceptance letter. I wonder if I'll be that mom that gets to help set up the dorm room. I will. I honestly believe I will. And I can say that to you today because of the hope that the MMRF brings me and thousands of other patients every day. I was a reluctant entrepreneur. I was scared to lead. But I will tell you, my life is rewarding and I'm happy. John Lennon is quoted with another story that has always fascinated me. At the age of 5, his mother told him that happiness was the key to success. So he went to school, and they asked him what he wanted to be when he grew up. He said, happy. They said, you don't understand the assignment. And he said, you don't understand life. I wish you great success. I wish you all good health. And I wish you happiness. Congratulations.
Kathy, thank you so much. In closing, I hope this day, which has turned out to be a beautiful one, has provided an opportunity to reflect and look forward on the adventures ahead of us. Thank you to our speakers for their inspiring words. A sincere thanks to my Class Day colleagues, Stephen Goldstein and Alex Ball, and to Kelly Diamond, without whom this day would not have been possible. And to HBS Operations for transforming Baker Lawn for graduation events. Thank you to the administration, to the faculty, and most importantly, to the family and friends of the class of 2011. Congratulations.